So my name is Hector Chapa. I'm an OBGYN physician. I'm actually one of the OBGYN hospitalists here at CHI St. Joseph in College Station, and I'm also one of the assistant clinical professors for Texas A&M College of Medicine. You know, historically, OBGYN physicians were in their office, and they still are, and then they'd run over to the hospital for their delivery or an emergency or whatever other need would be there. However, as human nature has it, sometimes those times weren't fast enough. So over the last really 10, maybe 12 years, there's been a move to have OBGYN physicians in labor and delivery or in the hospital itself just for quicker response times. So an OBGYN hospitalist is a OBGYN doctor who is not only in labor and delivery, but in the hospital overall to take care of any pregnancy issues, gynecology issues, any issues on the floor. So it means having 24/7 an OBGYN physician, not just around, but literally in the hospital, ready to answer any call that's necessary. I mean, emergencies are unpredictable. Things happen. It's just part of medical care, part of health care. And because those things sometimes are unpredictable, it's good to have a predictable presence of a physician on the site. So the ability to respond quickly is vital. And that's really should be the same for every discipline, but the truth is it's just not. So the ER thankfully has a physician or an advanced provider there. The ICU should have a physician or an advanced provider there. And labor and delivery should do the same. And that's what we have here at CHI St. Joseph in College Station. Most of what we do is for labor and delivery. I mean, labor and delivery is a busy unit. I mean, births don't take holidays, and they happen 24/7, 365. So the majority of what we do is OB. That's where this kind of misnomer, this reputation of OB hospitalist came in. And it's fine, although what we do is much broader than that. So yes, I'm an OB hospitalist, but I'm also a gynecology hospitalist. So I'm an OBGYN hospitalist, which takes care of both areas of women's health, OB and gynecology. You know, I think having this safety net, this OBGYN presence in labor and delivery in the hospital 24/7 should be a relief, not just to the patients, but to their doctors as well. So let's say a very well-meaning physician wants to be there as soon as possible. They just don't live around here. Having that peace of mind from a patient standpoint that someone's going to be there if something happens, and the provider can also rest assured that someone is there until they make it. That's a huge relief. Remember that the majority of medicine outside of the therapeutics and the drugs and the surgery that we use, a lot of that is our mindset, right? I mean, what you think going into this issue matters. And if we can make that process, at least that mental strain, a little less, knowing that there's somebody here in case something goes south, I think that's worth it.